So now let's move on to the next session, which is called CE Talk. And actually, this was inspired by the famous TED Talk, and we're hoping to give a stage to clinical engineers here in China to speak English and share their experience here in China. So first, let's welcome Mr. Chen Xuebin. He's the Vice Section Chief of the Department of Biomedical Engineering at the China-Japan Friendship Hospital. Welcome.
Hello everyone, I'm Chen Xuebin. It's a great honor to participate in the meeting. My report is about refined management of ventilator based on platform of Internet of Things for clinical application. I'm clinical engineer of China-Japan Friendship Hospital and Vice Chairman of Youth Committee of Medical Engineering, Beijing Medical Association. First, introduce about my hospital. China-Japan Friendship Hospital is founded in 1984. It's a young hospital, which is a product of China reform and opening up. The hospital has about 2,000 beds and 4,000 employees. As a national center for respiratory medicine, China-Japan Friendship Hospital has completed diagnosis and treatment system for respiratory disease. My report contains 3 parts. First, background of ventilator application. Second, ventilator management platform of IoT. 3, refined management examples based on the platform. Ventilator is a kind of medical equipment for emergency life support, so it's necessary to strengthen the management of clinical application. Wang Chen, Vice President of Chinese Academy of Engineering, also as one of the most famous doctors of respiratory medicine, he said, standardized application of ventilator in primary hospitals are needed. China-Japan Friendship Hospital is National Center for Respiratory Medicine, so we should strengthen ventilator standardized application. In our hospital, quality control and metrological tests are taken every year, but we found that regular quality control and metrological tests take a lot of manpower and time. Jennifer Jackson, former president of American Society of Clinical Engineers, he said data island problem for ventilator alarms and real-time parameters exist in every hospital. There are no central monitoring system for ventilators. The result of a questionnaire showed that convenient and effective training methods are needed for ventilator clinical application. So we construct the platform to solve the problem: quality control, maintenance, monitoring alarms, and training and assessment. We first established the quality control standard for ventilator in hospitals, and routine quality control for ventilator was taken at least once a year. And we also set up 3-level preventive maintenance. And based on the platform, the real-time data of the equipment contains alarm and parameters can be remotely monitored on the platform. We also set up training and assessment mechanism, and the online and offline training method are taken. This is a platform. The third part is about the refined management examples based on the platform. First, self-help shared ventilator. Second, reliability study of ventilator. 3, clinical application in the COVID-19. For the self-help shared ventilator, the program was to set up to solve the problem that the total amount of ventilator is large in our hospital, but some departments they are insufficient. The program was inspired by bike sharing based on Internet of Things in China. It's very famous. And multiple clinical departments was taken in to the team. And 6 specific streams of the self-help shared ventilator was established to solve the problem that operation process, equipment quality, clinical application, hospital infection and disinfection, cost sharing, evolution. The program has taken for about 3 years. The self-help shared ventilator was used about 36,000 hours a year. It's very good result. The second example is about the reliability study of ventilator. As one of the medical equipment of highest risk, ventilator must have high operational reliability. We use failure mode and effect analysis to assess the reliability of study. 54 component was analyzed, and the risk priority number was to evaluate the access the reliability of the components. The risk priority number is calculated by the occurrence of the failure of the component and the severity of the failure of the component and the detection failure of the component. The value occurrence, the value of the severity, and the value of the detection was determined for every component. The risk level of components is determined according to the RPM value in the table. The red part is high risk, middle yellow part is middle risk, and the green part is low risk. Oxygen sensor as one of the high risk component was analyzed. We use maintenance data to access live prediction of oxygen sensor with mobile mode, and real-time data to access performance accuracy of oxygen sensor with linearity detection. The result is good. The result was used to maintenance strategy of oxygen sensor. Proactive maintenance and preventive maintenance was taken. The third is about clinical application in COVID-19. In the early year of 2020, clinicians of China and Japan Friendship Hospital ran to Wuhan to detect the COVID-19. Based on the platform of IoT, we construct an emergency system. With the system, the doctor can see the data of the ventilator and monitor of the bedside remotely in clean area, which greatly improves the diagnosis and treatment for the patient. China Youth News and Health News report the system and regard it as a positive case. Some related articles and patents are published. That's all. This is the view of our hospital. It's very beautiful. And this is our team. This is my WeChat. Thanks.